Hi everyone, I am Noela Awa, a researcher at Effective Basic Services eBase Africa. Before I begin my presentation, I would like us to reflect on this. Of what use is evidence if it cannot get to those who need it in a format that they can access and in a language that they understand? Join me as we explore how we developed the Computable 2024 Malaria Management Guidelines for healthcare workers in Cameroon to improve access to evidence-based decision-making. Why Computable Guidelines? Malaria remains a global public health challenge, particularly in Central Africa, and Cameroon holds the 11th position worldwide, recording 2.6% of malaria cases in the year 2022. Also, Cameroon is third in Central Africa with 12.6% of malaria cases, as reported by the WHO Global Malaria Report of 2020. And because of this, Cameroon faces several challenges, particularly in rural areas. Healthcare workers handle several malaria cases daily, sometimes using outdated guidelines. Also, there is limited access to hard copies, and soft copies are not readily available online. In several areas in Cameroon, there is poor internet connectivity, and all these aspects lead to higher risk of clinical errors, despite the strong commitment of the healthcare workers in Cameroon. This implies that there is an urgent need to access to updated, locally relevant guidelines to minimize errors and improve care. And this will go a long way to achieve the 75% of reduction in morbidity and mortality caused by malaria by the year 2028. That is why the Computable Publishing Limited Liability Company, the Health Evidence Knowledge Accelerator, the HEFCA Group, and Effective Basic Services Africa made the guidelines computable on the FEvIR platform and created an offline PDF version as well in a bid to improve access to the 2024 Malaria Management Guidelines. And this goes a long way to empower healthcare personnel to make informed decisions regardless of the different challenges that they face, including connectivity constraints. So how did we do this? Thanks to the expertise of the Computable Publishing Limited Liability Companies team, the textual guidelines, which were approximately 178 pages, were transformed into computable formats that was hosted online on the FEvIR Fast Evidence Interoperability Resources platform. And this was complemented by an offline PDF version optimized for use on diverse devices. Preliminary engagement through surveys and usability testing informed progressive improvements, and this went a long way to refine the computable guidelines on the FEvIR platform. So I was fortunate to be part of the team that made these guidelines computable, and it was an amazing experience. Despite me not being a developer, we were able to make these guidelines computable through a straightforward process. So we moved from a bulky Word document that contained tables, figures, and different kinds of illustrations to the FEvIR.net website through editing and refinement. And this was done during the Computable Guidelines Working Group weekly meetings and additional free time slots. So you can see how the Computable Guidelines look using a computer above and using a mobile device below. And this goes a long way to make sure that every healthcare worker in Cameroon can easily and readily access these computable guidelines. So beyond these basic properties of the computable guidelines or the FEvIR platform, there are other amazing and very essential aspects. For example, there is a possibility to integrate ratings and justifications, and this was exploited, and it enabled us to have the ratings and justifications that were absent from our guidelines, that is our original Word document, via linked sections in the computable guidelines. And this led to external resources, that is the WHO guidelines on the FEvIR or on the Magic app. This helps the healthcare workers to be able to access these ratings and justifications. There was also improvement in clarity and navigation, and the platform is very user-friendly. And other features such as auto-linked references and sidebar table of contents enhance and ease the use of these computable guidelines. So the computable guidelines will go a long way to enhance accessibility and usability, thereby facilitating evidence-informed clinical decision-making, even in remote settings and areas in Cameroon. And this will go a long way to save lives. And the dual format, that is the offline PDF version and the online computable guidelines, this dual format is an innovative approach, and it helps to minimize errors, thereby improving care and fostering health equity by ensuring that all healthcare workers can integrate up-to-date malaria management practices in their daily routines. So what is our view, or what are our perspectives? We would make use of evidence-driven approaches to integrate these guidelines into clinical practices in the different healthcare facilities in Cameroon. And this will be done in 3 different stages. The first stage will be the piloting stage. During this stage, there will be test feasibility, usability, and accessibility in selected districts in Cameroon. And mind you, we have 205 health districts in Cameroon. The second stage will be the impact evaluation stage, where there will be assess of effectiveness on the health outcomes before we scale up. And lastly, there will be the dissemination stage that will be carried out nationwide based on the evidence from the pilot and the evaluation stages. And this will build a strong evidence base for government adoption and sustainability and sustainable implementation. So, by advancing innovative digital tools adapted to our realities, this initiative illustrates how technology can overcome infrastructural challenges to support evidence-informed decision-making in Africa. Thereby, scaling and sustaining such approaches can accelerate progress toward malaria control and broader health system strengthening. So to view these computable guidelines, kindly scan the quick response code. Thank you for listening.